Navigating social skills for special needs children. What exactly do we mean by social skills? For the most part, social skills are both verbal and nonverbal. Verbal skills include being able to determine the appropriate thing to say at the appropriate time, being able to communicate in ways that are engaging, having a range of vocal tone and quality, and being able to speak in a reasonably understandable manner. Nonverbal include spatial distance, facial expression, and mannerisms. The word skill is defined as a learned and acquired ability. For some, these skills come easier than others. Social skills are rules and guidelines that create opportunities for us to interact with others. Children who experience social skill challenges do so for a variety of different reasons. I have included some for your review. Keep in mind, not all kids who experience these disorders have social skill challenges, while others may have these challenges without an official diagnosis. These children find themselves trying to navigate their way around in social situations without a map. As a result, they feel very lost. Components of social skills could be broken down into one, some, or all these areas. A breakdown in one area could prevent a child from mastering a skill in another area. It may be difficult for some to realize all the components involved in a successful social interaction. Again, the behaviors we see are the result of deficits and not choices of the child. It is a skill not yet mastered. Social skill deficits could directly or indirectly impact on many life areas of a child. They could cause breakdowns in one area, which may lead to breakdowns in others. These breakdowns could also have serious impact for individuals that could carry over into adulthood. Parent role is extremely important in helping children improve. I mentioned before about many areas social skills could break down. Observe where your child is having the most challenges. If it is in several areas, pick a starting point for him. Target a measurable goal and keep practicing. Also, try to predict situations ahead of time that will be more challenging for your child. Help him study and prepare for this situation. This will give him needed confidence to take on further social challenges. I've included some additional suggestions for you. Now, one consideration to keep in mind: to learn, we must be able to push ourselves beyond our comfort level. This is really how we overcome barriers. However, pushing too far could be counterproductive. Make sure you keep that balance in mind. Gauging responses and getting your child to verbalize where they are at emotionally will give them a better opportunity to feel confident and in control of situations. This is important feedback for you, as well as being able to have the child check in to see where they're at emotionally in any given situation. Choose an environment to practice in. Remember, comfortable is okay as long as it doesn't get to be complacency. Friends or relatives' house or a park could be okay. You want to be comfortable in being able to teach these skills to your child as well. So a place where you're going to be able to offer instruction and feedback could be an important consideration as well. Evaluate you and your child's goals. Process these interactions, the good and the not so good. Constructively point out areas to work on. Be patient yourself. Remember, if you show impatience and are discouraged, your child most likely will start to feel the same way. Other resources to consider are park districts who may have programs running for special needs children. Utilization of social stories to go over situations with your child is also helpful. Schools may have social groups running where kids with similar challenges could all be together. Finding a supportive sensei for martial arts could pay off huge dividends. Prior to having your child placed in one of these resources, talk to the person in charge and discuss a game plan for your child. Keep in mind this is going to be a process and a journey that you and your child are going to go through. It's not a one-time event. If you or your child seems stuck, call a specialist in your area who may be able to further help you and your child navigate your way through this. Remember, keep trying and hang in there.